Today's presentation will be given by Lydia Lee, Associate Professor in the U of M School of Social Work. Her research areas include social support in later life, stress and coping of family caregivers, dynamics of formal and informal care, health trajectories of home care elders, and late life depression and suicide. She's interested in cross-cultural research, and her most recent work involves community-based interventions for and epidemiological studies of late life depression in China. She is a fellow of the Gerontological Society of America and a Hartford Geriatric Social Work faculty scholar. And currently she serves on the editorial board of the Journey of Gerontological Social Work and is an associate editor of BMC Geriatrics. She is advisor of the Specialist in Aging Certificate and the lead faculty for the Gerontology Learning Community at the U of M School of Social Work, and she is affiliated with the Center for Chinese Studies and Population Studies Center at the University of Michigan. And Lydia and I had a student 2 years ago who finished her dissertation on aging in China, and I did ethnographic work for that by running in Changfeng Park last year when I was in sabbatical in Shanghai, noting how many older people in China are out exercising in the early morning. So maybe she will mention that in her talk today. Anyway, her talk is Successful Aging in Transitional China, Accomplishment and Challenges. Please join me in welcoming her. Thank you.
Well, good afternoon, everyone. Thank you for the opportunity to speak with you today, and I was aware that I'm the first one in this whole year series of the Noon Lecture, right? Okay, it's a great honor. Thank you. Before I address this topic, I want to give a set of a background of this talk. Okay. First, this should not be new to you that China is aging very rapidly, population aging. Okay, so I'm not going to say more, so you all know, I heard many times. And it's remarkable if you look at the life expectancy increase. 1980, on average, people live about, 67 years old. And 2010, actually now, is close to 75 years old on average. So it's a very remarkable achievement in terms of lengthening of life. However, living a long life does not necessarily mean living a healthy life. Okay? A long and unhealthy life can be a drain, actually sure is, a drain to your personal resources as well as national resources. Particularly considering China has we have the largest number of older people in the world. Okay? So if a lot of people live a long time but unhealthy, it has huge implication, to the demand for healthcare, long-term care, and the economic growth. A successful aging is a very popular term, used in media as well as in the gerontology literature. And people usually don't define it. Okay, even its definition is many, many definitions. So I'm going to go with the layman conceptualization, and actually is across many definitions in the world, it's come down to the essence is that being healthy in old age. And actually that's everyone want. If you want people, do you want to live to very old age? Sure, if I'm healthy. Would you say so? Okay, so being healthy in old age, that's kind of a desired state by individuals as well as by family, the whole society or the state. And this concept is popular for a reason, is that it provides a direction for individuals as well as for the government, to think about how to meet the challenges of population aging, successful aging, help people to lead, to age successfully, to have a healthy old age. That's the direction. And in China, that's interesting is that this, demographic shift in terms of population aging is occurring in an economic transition as well. You all probably are very aware of this China's economic reforms that began in 1979, and the great success, economic growth in China. So there's good news here. The population aging occurred in this time. It means more resources are available to meet the challenges. But also there's bad news. There's bad news because in this economic growth, we have problems related to rising income inequality, in the very rapid rate of industrialization and urbanization, that also has associated problem, which I'll talk more about. So this is the context I want to kind of provide of, the contemporary China, have experiencing this demographic shift, and how are we doing in terms of several things. Okay, so the presentation today, I was hoping that we'll have at least 10 minutes to discussion, but the late start, I don't know. Okay, I'm aiming at that, okay? We'll have at least 10 minutes for discussion. So these are the questions I want to address today. Okay. Has there been more success in successful aging since China's economic reforms? And second, who among the Chinese are more likely or less likely to age successfully? And third, I'm looking for the more future. Okay, the trend of successful aging, given the rapid rate of industrialization and urbanization, what can we expect? So these are the three questions that I was interested to know the answer. And the way I tried to find the answer was to take stocks of the empirical study and the literature. Okay, so it's by reviewing empirical studies related to, older Chinese physical health and mental health. Okay, physical health related to, indicators of physical health, their physical functioning, their disability, their chronic disease, and those are indicators of physical health. And mental health, their cognitive function, their depression. Okay, so I reviewed the literature related to, this older Chinese health. Okay, the first question is more success, means that have we gained more in terms of older people's health? In order to answer these questions, we need this called time trend studies. In other words, the longitudinal data to compare, older people in different time or different cohorts of older people, how their health was. Okay, so that to see whether we are improving as a population. These data are rare. Those time trend studies follow different cohorts of people. For what I can find, the few time trend studies, they show that more current cohort of older people were healthier than the previous cohort. For example, look at the disability-free life expectancy, which means that how many more years that one can expect to live without disability. Okay. So a study that used national data, and the data, one was collected in 1987, another in 1992, suggests that, for 65 years old and older, this older population, on average, they gain 2 more years of disability-free life expectancy. And between 1992 to 2002, there's another study. Okay, they also show that there is, as a whole, gain more this time in terms of live without disability. But it depends how many years gained. It depends on the gender and the age. Okay, in this study, also using national representative sample, so that women actually gains more. And this the first study actually is a national survey of disability status. Okay, one was done in 1987, another 2006, so it's a huge time span for us to see. And they found that the rate of disability or the preference of disability was lower in 2006 compared to 1987. So which means that, overall, people are less disabled. But this was found only among the older age group, 75 years and older. And the trend for the middle age group actually are somewhat worrisome. Okay, which I'm going to go back later for this particular group, because they found improvement in the older age group, but not so in those middle-aged people. Another indicator of, whether people are healthier is the age that disability got onset, when did it occur. So there's a study who found that between 1987 and 2006, the onset of physical disability was delayed 4.7 years. Okay, so it's another indicator of improvement. Also, it's found that in terms of disease-free life expectancy, which means that how many more years you can live, expect to live without chronic illness. Again, we find that there's an increase, between 1992 to 2002. There's about 1.4 years increase for persons who are 65 years old. Okay, so you can live 1.5, if you're 65 years old, you can live 1.4 more years without major chronic illness, in 2002, where compared to if you were the same age person in 1992. Okay, so answer the question, is that we're doing better? Yes, there's evidence of improvement in physical health of older people, over time. But the trend in mental health is more difficult to tell because of how the measure is, what measure is used, how that decide what the instrument they use to measure depression, and the way they collect data is quite inconsistent over time, so it's very hard to compare. Okay, so now I move to another question. Okay, people are healthier, more people enjoy good health in old age. But is there, who are more likely or less likely to age successfully? Or another way to ask the question is, are the opportunity to age successfully equally distributed? Well, studies, a lot of study has been done in this area actually. Studies tend to show that there's a lot of health disabilities in old age among Chinese. Okay, there are differences between people living in rural and urban area, living in different regions. People have different socioeconomic status, as well as difference between gender. I'm going to say a little bit more about urban-rural difference because that's a lot have been done, and then I'll also talk a little bit about the other differences. Okay, the studies show that in terms of physical health, rural elderly people compared to those living in urban area, they have fewer years of disability-free life expectancy. Okay, so it means that they spend more years in a disabled state. And also, the time they transition from being physically independent to physically dependent is shorter. Okay. And in general, their rate of disability is higher in rural than urban elders. Okay, that's the physical health aspect. In terms of mental health, in terms of cognitive impairment, well, what I have found is that the findings are still mixed. For example, their study found that rural elderly people have higher rate of Alzheimer's disease, but lower rate of vascular dementia. So it's still out there, the jury is whether in terms of cognitive impairment, whether there's significant difference between rural and urban. But one consistent findings, across many studies is that older people in rural area are more likely to be depressed or have higher level of depression compared to those in urban area. So depression has a very clear rural and urban differences among older people. There's also regional difference, in older people's health. And part of that is, in western region, they're more rural area than in eastern region. But on top of that, still, even you control for the rural-urban, there's still a regional difference in health. The overall story is that older people living in the western and central regions of China, they have worse health than those living in eastern regions. For example, we are talking about the disability-free life expectancy. Okay, if you're 60 years old, if you live in eastern regions like Shanghai, Zhejiang, Jiangsu, those eastern regions, you can expect to have 14.8 more years to live without disability, okay, if you live in the eastern region. But if you live in western region, okay, tell me a place that's western region. All right, very good, thank you. Okay, then you expect to have 12.8 more years to live without disability. So it's about 2 years difference. In mental health, it's the same story, okay, regional difference. So this meta-analysis means that they kind of get a lot of study together and look at the mild cognitive impairment, how prevalent it is. Okay. In Western region, the preference rate, I mean older people have mild cognitive impairment is 14.7%, but the Eastern region is 9.6%. So it's a difference there, the likelihood of having mild cognitive impairment. So what are the reason for the difference, by residence, where you live matters to your physical and mental health. What are the major reasons? Probably a lot of reasons, but the two major reasons study have found is one is related to the healthcare access. People living in rural area and in Western region, they have more barriers to access healthcare. That has a lot to do with the healthcare resources distribution. Okay, for example, in terms of the ratio between number of residents and number of physicians and number of hospital beds, there's lots of difference, huge difference between urban and rural areas. And another access is related to, access barrier is related to the cost of healthcare. Now, almost, China has universal health care coverage, but it was not the case. Okay, between particularly in rural area, we know that the collective healthcare system collapsed when the economic reform began. Okay, it was until 1993 that the Chinese government began to launch the new cooperative health scheme. So there's a huge gap there, from 1979 to 1993. Okay, there are huge drop in health insurance coverage, particularly among rural people. Okay. So that has some significance to, when you don't seek health when you're sick, there has some consequence when you're in the later age. Another thing is that, people in rural area and western region, they are lower incomes. Okay. So relatively, the cost of care to them is high, although from our perspective, it doesn't cost much, it's just $5 or $10, but relatively, that's high. So, there's also a financial barrier. Area of wealth matters, okay? Eastern region are much wealthier than Western and Central region, so that makes a difference. A study found that, if you control for the GDP of the region and control for the healthcare resources, such as the ratio of hospital beds per 10,000 people, you control for these factors, the regional differences in health reduced by 28 to 40%. So it means that matters, the healthcare resources and the wealth of the place matters to individuals' health. Beyond that, beyond where you live, your region, your urban, rural, another thing matter is that people's income and education matters a lot to their health. So given they live in the same region, either in rural or urban, the same place, same age, same gender, we found that people who have low income and low education, they are more likely to have poor physical functioning, a higher rate of hypertension, higher rate of Alzheimer's disease, mild and severe cognitive impairment, and higher rates of depression. Okay. So these socioeconomic differentials in health actually is very parallel to what we found in the Western nations as well. But that happened in China. There's also gender difference in health. Quite consistently, we found that older women, they have worse health than older men. Women are more likely to be disabled, given the same age, more frail, more likely to have Alzheimer's disease, and mild cognitive impairment, and more like depression. Actually, all this above 3 are very consistent with the Western findings, except number 4, depression. In China, we have mixed findings. In the Western nation, we usually find older women are more depressed than older men, or women are more depressed than men in general. But in China, the findings are still mixed. Okay, some find that women are more depressed, and some find men are more depressed. So it's not known yet. The gender difference also have, particularly in cognitive impairment, is that you did a study? They found that the gender difference has a lot to do with difference in their education and income. So if you control for their occupation, control for their education, the gender difference in mild cognitive impairment reduce a lot. Okay, so gender difference in this health has a lot to do with the socioeconomic difference between gender. Okay, so go back to the question. Who are more and less likely to age successfully? Why? Well, we know from the literature, we know the answer is that older people who live in urban area, in eastern region, the higher education and income, and who are men, they are more likely to experience successful aging. Okay, wish you were born differently now. And these differences, this health disparity, reflects the structural inequality in Chinese society. In other words, the health in old age is more than just your individual choice or your individual behavior. It's more related to some structural issues there, resources distribution, or the whole, gender difference in their educational and income attainment. Okay, I'm moving to the third question. How would the trend of successful aging be affected by rapid industrialization and urbanization? Of note that China has the fastest rate of urbanization ever recorded. Okay, so it's a record, in terms of how fast China urbanized. These are the figures. You can see how many times in terms of the urban population. Okay, from 191 million in 1980, less than 20 years, up to 622 million people in the urban area. And a big factor of this rapid urbanization is the rural to urban migration. Okay, we have huge, almost 40% of our urban population are migrants. Another factor is the expansion of urban area through converting the farmland for urban use. Okay, so it's just the area expansion. Along with this rapid urbanization, also came to changes, changes in individual's life as well as the environment. Chinese are undergoing many changes in their lifestyle. Okay, and the environment also undergoing changes in terms of pollution and urban and all more urban hazards. I will talk about each in turn. Okay, talk about change in lifestyle. Okay, if you go to China today, you'll find very different types of restaurants versus you went to China 30 years ago. Okay, well, I just came back from Zhejiang, Kentucky Fried Chicken. In one corner I can find 3 Kentucky Fried Chicken. I wish I would buy this. I should buy the stock. There's a lot of fast food restaurants popping up in Chinese cities. You must have noticed, right? You cannot not notice. Chinese changing their diet from the traditional, we go on the rice, a lot of vegetables, to more Western diet dominated by this high fat content, processed food. Okay, that's one change. Big change, actually, in terms of diet. And kids, if you ask Chinese kids, what do they want to eat? Huh? McDonald's, pizza, Coca-Cola, yeah, Kentucky Fried Chicken again. I'm amazed on the line in Kentucky Fried Chicken. And another change in their lifestyle is the physical activity. Okay, it's much reduced in terms of the level of physical activity due to change in their work pattern. Okay, now more people are work, in those set kind of, you can sit there. You don't need a lot of movement. Versus in the past, more people work in the farmland, a lot of, labor working, exercising. But now it's not. They changed their job. Transportation mode is much more people are much prefer to use motorized vehicles, for going somewhere, right? In the past, I remember 30 years ago, most people just walk or using the bicycle. But now, I just went back and noticed, even students, they're college students, they go from A to B. I said, let's walk. No, let's take a cab. I said, what's wrong with you guys, these young people? Okay, they're so used to this using cab, used car now, so that's another change. Also, another change is that it's much more preferred or prefer to spend their leisure time sitting, watching TV. Okay, so that's another change. All this contributing to the lower level of physical activity, among Chinese. And this change has consequence. One consequence is that China has very rapid increase of overweight and obesity among its elder population in young and middle age group. Okay, this is in terms of the increased rate of overweight and obesity, it's also, I'm talking about the rate of increase, is highest ever recorded. Okay, one estimation is that 1/5 of Chinese adult, 20%, are overweight in 2004. Okay, 1 in 5, gosh. And compare 1989 to versus 2006, obesity rate double in men and double in women and triple in men. Now for the between the age of 18 to 50. Okay. I don't know whether you notice, but if you go to city, you see a lot of bigger and bigger people. This has consequences because these risk factors, obesity, overweight, in young and middle age, are likely to increase the risk of non-communicable diseases. And that manifests particularly in old age, such as what disease? A lot of diabetes, cardiovascular disease, cancer, yeah, maybe cancer. I'm not quite sure about weight and related cancer, but heart disease, osteoarthritis. Okay, those are non-communicable disease, and also a disability-driven disease. Kind of osteoarthritis is a big cause of physical disability. So these have consequences. Another company of this rapid urbanization and its transition is pollution. Air pollution, probably I don't need to say more. Okay, there's an alarm being issued in terms of Beijing or those big cities, the problem of air pollution. And as a study, looking into how air pollutions affect older people's health, they found that people who live in poor in areas that have poor quality, have fewer healthy life expectancy compared to people who live in good quality area. Healthy life expectancy means that, in their definition, is that how many more years you can expect to live without disability and without chronic illness. Okay. So for women, I think it's about 4 years difference. Okay, if you live in a good versus a poor air quality area. Okay, for men it's about 2-point-something years. Okay, so it matters to health. Water, another issue, water pollution. Okay, it's according to China Ministry of Environmental Protection. More than half of China's river severely polluted, which means that there's a much reduced access to potable water and an increase in these waterborne diseases. Okay, and this particularly for rural population. You know, they are much more dependent on river or unprocessed water for their drinking water. There's also an increase in urban hazards, you know, coming with this rapid urbanization. It's been reported there's increase in industrial accidents and occupational diseases. And this, you know, not only because we have more industry, more factories, but also because of the weak workforce safety enforcement. So that's an, you know, China is still working in this area. But we have seen more of this industry accidents and occupational diseases. Also more report of traffic-related injury and death. Okay. Actually, crossing roads in China is one of the things that I, you know, top of my list of what I'm afraid of. Okay, I think you really have to be trained to cross the road in China. This congested roadway is very challenging to pedestrians and to cyclists. Okay, so it's a lot of risk of injury and death related to traffic issues. In urban environment, also there's increase in psychological stresses like noise, overcrowding, social isolations. These are all will have impact on the physical and psychological and mental health. Okay, let me conclude here. Addressing the 3 questions I asked earlier. Okay, based on the empirical studies conducted so far, it seems that recent cohort of older Chinese, they have better health than previous cohort. So we are doing better, you know, in terms of successful aging, okay, getting people healthier in old age. But also we noticed that the opportunities to really have a healthy old age, they are not equally distributed and are linked to the structural inequalities in Chinese society. Looking to the prospect of successful aging, there's some concern because the rapid urbanization has intensified these risk factors for chronic illness and disability. So that is still question out there of, you know, what's the next cohort of older people's health. So that's probably I should stop here, and I welcome questions and comments and your thought.
The data you presented at the beginning seems to be counterintuitive to the data you presented at the end. At the beginning, you presented data showing that population tends to have, elder population tends to have a better quality of life as aging in the urban area versus the rural area. Nevertheless, it seems to be the quality of life from many of these parameters much worse in the urban area than in the rural area.
So you're saying that, you know, for the urban area, there is going to be a lot of these risk factors are there.
Right.
So it's, yeah, possibly. We don't know. I mean, this is what is happening. You remember when I'm talking about the disability trends, there's we found that older people seem to have compare two different cohorts, the earlier cohort and the recent cohort. In terms of the older age population, there's improvement, but not in the middle age people. Okay, some of them may be related to this urbanization issue, as well as the industrial accidents and occupational diseases. So the current cohort of middle-aged people or working-age people, the current cohort, they live in this urban situation. So when they get older, do they still maintain the advantage of health occupied by urban population as in the past? We don't know. Does it make sense to you?
Right. In other words, this probably affecting the middle-aged population now, but in the future it's going to affect also.
Yeah. Yeah. But also, these are urban hazards, but the urban hazard also is expanding to the rural areas, like pollution. Okay? The air don't stay in one place, they go somewhere else. The water. Okay.
Lydia, most of the statistics you have shown are widely known and they're really no surprise. But sometimes the issue is really interpretation. I would like to question your first interpretation. For example, you said that successful aging improved a lot as a result of economic reform, but one could say it's just almost everywhere you see improvement, even there is no economic reform. In Japan, in Korea, in Taiwan, everywhere we have improvement in health due to medical improvement, due to education, due to lots of things. And if you look at a longer trend, you show the recent trend, I think life expectancy improved even more rapidly in the 50s, right after the founding of the People's Republic of China. So in some ways, improvement in life expectancy or mortality reverse has slowed down in the economic reform era compared to what we would have expected as a result of economic development. I think most people, demographers, will say we see a slowdown rather than a huge improvement compared to economic development, because there was not a lot of resources in the 50s, but we saw much more rapid improvement in mortality.
Yeah, good point. We don't know what is the cause of the improvement. Okay, I just say that we see improvement over time.
That's right.
I don't say that it's caused by economic reform.
Not necessarily economic reform.
Not necessarily caused by economic reform. But you're right, it can be just without reform, we may be improving, we don't know, okay?
And Korea, for example, improved a lot more than China. They didn't have economic reform.
But the economic growth also is tied to their improvement in health too. So, but it's not deniable that the economic reform has raised the standard of living of Chinese overall, and enable people to have a lot more healthcare resources than before. But whether this cost is still out there, what caused the change? Yes.
I'm wondering, as an older person myself, when people flee or migrate to the urban areas, does that leave the grandparents, does that leave them in the villages alone and more isolated and away from their extended family, which may cause more depression in a culture that always respected their elders? Do the elders feel like they've been abandoned?
Yeah, that is actually an issue that is kind of getting a lot of research attention and also practitioners' attention. This migration and leaving the old, staying behind.
Yeah.
Okay, and I have not seen. I heard some villages kind of 80% is older people. This all gone. But the only study that I did myself, I went to Shandong to do the study, and I found that yes, there's a lot of young people migrated. But I found that, because that in that generation just now, if the older people are 70 years old or 80 years old, they tend to have multiple children, okay, more than one. So what the arrangement I saw is that they have one left behind at least to to take care of the parent, and the others who are in the cities, they send money, for the brother to take care of the parent there. But I know that in some other part of China village, there's kind of a lot young people out.
Just quickly to focus on the phenomenon of urbanization, your empirical data, and I think it's accepted, is that urbanization has led, as you say, to greater risk factors for chronic illness and disability. I'm reading from your slide. But at the same time, one would assume that urbanization also brings people broadly closer to healthcare services, better healthcare services in terms of preventative application. So my question is it possible that this is sort of a unidirectional development, that as increased urbanization happens, there's worse and worse health outcomes for people who are getting elderly? Or is there hope that actually urbanization brings that same population closer to better and more accessible services?
Yeah, very good point. Urbanization has a lot of good things. Like, usually you have better access to information as well as a health service, right? So you should do better. So I completely agree there's some good point of, this urbanization. But what we see is that the rapid increase of obesity and overweight, that is worrisome, very worrisome, okay, as, they left. So a lot of risk factor for a whole bunch of non-communicable diseases. Okay, so whether it balance out, I doubt. Yes. Yeah.
I wonder, continuing on what this gentleman over here said, we're taking a picture that starts in 1980 and takes it forward. If you look at the 30 years before then, it's a disaster. I mean, as far as a socioeconomic situation, you had the revolution, you had the mop-up. After that, you had the Great Leap Forward, you had the Cultural Revolution. And people lived through all these things. Talk to a senior person in those times, they survived all of that. And so now we have a time of relative peace. And I think could this sort of be expected?
Another very good point, yes. Maybe the older people we are talking about, they are a selective group. In other words, they are resilient because they have gone through all those turmoils in Chinese history. Okay, a lot of starvation, civil war. Okay, a lot of poverty. They live. Okay, so maybe that is why we saw they do better. Okay, that could be an explanation. Okay.
Could you compare what the research that you've done in the PRC to what you know about aging in Hong Kong? Because Hong Kong has gone through a similar process, but just earlier. And it seems that it would be a good way to, at least in terms of prescription, to make policy recommendations going forward.
Mm-hmm.
And it also has lots of fast food, I've noticed.
You do? Well, actually, I'm proud I came from Hong Kong. Hong Kong has the longest life expectancy. I think it's in the world. Okay, the village I came from actually has the longest life expectancy in the world. Really, and the village I, was born and grew up, it's by the sea. We ate a lot of seafood, and there's also kind of farms. We ate from the farms. We ate really, really fresh fish from the water that day. So that's why we lived so long. Anyway, Hong Kong. Number one is very different. Hong Kong is a small place, compared to China. It's very difficult. I mean, China is very. Sometimes it's hard to talk about China because China is so big. Okay, people live in Shanghai and live in Xinjiang, whole different world. Okay, so it's difficult. But Hong Kong has older people has good health. One reason I think has a lot to do with the universal health coverage consistently. Hong Kong has had universal health coverage all over, from when I was young to now. Okay, so that's one thing. And another, Hong Kong does not have social security like us. More recent, they have this called Central Provident Fund. But Hong Kong has this, we call it OH allowance, a small amount, but it's universal. Everyone has it. So it's kind of giving a floor for people who are poor. They have some money. Okay. So with this universal health care coverage and some economic security, that helped older people in Hong Kong to, I think, live healthier than if there was none. So I don't know how to compare. I think Hong Kong show a very positive trend in successful aging in terms of the healthy life expectancy that they are having. Okay. But also, like many places, they also kind of came across, the burden of healthcare is staggering. It's very, very high now. So they are thinking of, have to get rid of this universal health care coverage, have to charge more, for health services. So they are talking about that.
One thing when you think about when you try to predict the successful aging in the future, one thing positive is more and more Chinese are getting more education. I think if you look at the older adults, very few people got college education. And today, a lot, a high percentage of young people are getting that. And higher education is associated with lower disability and chronic illness. So there's another positive things, when you think about successful aging for future cohorts of older adults.
Yeah, I don't have a crystal ball exactly. Yeah. So that's good. Many factors to consider. But I saw the overweight and obesity rate is very alarming and really a concern. Education probably help. Yeah.
I have another thing. I'm not sure whether you have considered the hukou system in China, because I know in China where you born and where you living now is really different. Because I'm from Shenzhen. Let's say a migrant worker whose hukou is in Xinjiang, but he or she is living in Shenzhen. His or her access to the health system is different. She or he may be paying higher price for the same health care compared to the Shenzhen people, as the Shenzhen people there.
Yeah.
So I'm not sure. I just would like your opinion about how the hukou system will have some impact on the urbanization and also the successful aging.
So are you concerned about the health prospect of migrants, particularly those people who are rural Wuhan, but were kind of working in the urban area? Yeah, that's a concern. Particularly as we'll talk about this urban hazards. You can imagine migrants probably are more likely to be exposed to this urban hazard. For example, they have fewer choices of jobs, okay, which led to maybe they're more likely to work in environments that are not healthy. They're more dangerous working environment. Also, they are more likely to live in the overcrowded area in the city. Okay, overcrowded, lots of noise. Okay. Also, they are away from their support system. Okay, may be more likely to experience this isolation. Okay, so that is really a concern about the health of migrant workers as they get older. Okay, what would that experience worse health compared to those non-migrant? And as I said, the migrant population is very huge in China. Okay, if they as a whole group experience poor health, there's huge implications to the future cohort of older adults' health, as well as to the healthcare expenses. Yes, one last question, I guess.
I wanted to return to the topic of mental illness being higher in the countryside. I wanted to ask you about that. That to me seems like it's contrary to what I would have expected and many other people perhaps. Is there a question of counting sufferers of mental illness? Could there be more consciousness in the countryside? I would expect more consciousness in the urban areas, but maybe not. Or do you think there's something special about the countryside that produces mental illness possibly?
Yeah, so asking whether there's a measurement issue, right? In terms of measuring mental health problems in rural and urban area. Yeah, but I'm addressing a particular depression. Depression studies, they have used different ways to measure it. Some ways clinicians, they go to this, psychiatrist personal interviews, and some way use this kind of screening instrument, which is kind of standardized. They all come up with the same result. Okay, rate of depression is higher in rural area versus urban areas, among older people. Okay, so what's another problem?
Yeah, I'm curious. So what are the
Main reason? Yeah, I would think, okay, actually there's also empirical support that poverty has a lot to do with depression. Okay. And older people in rural area probably are more likely to experience high level of poverty or extreme poverty, okay, which has a lot to do with, think of that if you have health problems and you're an older person, okay, you have health problems and you're poor, your family is poor, okay, and you are draining your family's resources to treat your health problem. I mean, I probably get depressed too. So this is just this environmental stress for them.
Based on alienation or
I think I was,
problems, or losing having your only child in the village, is that also speculated?
yeah. Well, nutrition can be an issue. Yeah, it can be. But those are more recent, factors in terms of this kind of children away. Okay, it could be those are still to be investigated, but pretty solid risk factors for depression in China is socioeconomic status, your family income, is huge predictors. Another is education. Okay, so the low education and low incomes of the rural populations make them vulnerable to depression. And then in older people, you get another one, health problems. Okay, you're doomed.
On that optimistic note, thank you very much.
Thank you.